Jen.
Hello, my name is Derek and I'm a first semester student nurse. I'm going to do your head to toe assessment today. Can you tell me your name and date of birth?
Jenny, 6685.
Okay. Before we get started, I'm going to wash my hands. The nurse tech has already came in and taken your vital signs, so I'm just going to get started. I'm going to start out by inspecting and palpating your scalp for any lesions, any abnormalities, or any depressions. And now I'm going to palpate your maxillary sinus. Tell me if you have any pain or tenderness.
No.
On your frontal sinus?
No.
Okay, now I'm going to percuss for any fluids. Okay, now I'm going to palpate your TMJ or your temporal mandibular joint. Now have you open your mouth? Close. One more time. Close. There was no grinding or clicking. Now I'm going to test cranial nerve number 7, your facial nerve, by having you smile real big. Puff out your cheeks. Alright, now I'm going to test cranial nerve number 5, your trigeminal nerve. Now have you close your eyes. Tell me when you feel this.
Yes. Yes.
Okay, good. Now I'm going to move on to your eyes. I'm going to check your conjunctiva, have you look up. Okay, it's pink and moist. Now look down. Sclera is white and moist. Your eyes are bilaterally symmetric. Okay, now I'm going to check your pupils. Okay, they react equally. Now I'm going to check accommodation. Have you look at my pen and at the wall and back at my pen. Okay, they both accommodate equally. Now, we already tested cranial nerve number 2, your optic nerve, on the Snellen chart. Your vision was 20/20. Now I'm going to test your extraocular muscles by using the 6 cardinal gazes. That's cranial nerve 3, 4, and 6. Your ocular motor, your trochlear, and your abducens. I'm going to have you follow my pen without moving your head. Okay, so you don't have a deviated septum. Okay. I'm going to check your patency. Sniff. Sniff. Okay, there's no blockage. Now have you flare your nostrils. Okay, flaring was symmetric. Okay, now I'm going to test cranial nerve number 1, your olfactory nerve, by having you identify a common odor. What is this?
Alcohol.
Okay, good. Now I'm going to move on to your ears. I'm going to pull on your auricle to make me pain or tenderness.
Yeah.
On your tragus. Okay, now I'm going to have you put your finger in your ear. On the other ear, please. Okay, I'm going to test cranial nerve number 8, your acoustic nerve. I'm going to have you repeat after me.
5, 6, 7,
8, 9.
8, 9, 10.
Right, good. Now I'm going to move on to your mouth. Normally I would palpate your lips and your tongue, but we're not going to do that today. But I'm going to inspect them for any lesions, make sure they're pink and moist, which they are. And now I'm going to have you open your mouth. Okay, the buccal membrane is pink and moist. Your teeth are white and aligned. Your gums are pink and there's no white spots. And have you stick out your tongue and move it side to side. Okay, that's testing cranial nerve number 12, your hypoglossal nerve. Now I'm going to have you say ah.
Ah.
Okay, there's no deviation of the uvula. That's testing cranial nerve number 10, your vagus nerve. And normally I would test cranial nerve number 9, your glossopharyngeal nerve, by testing a gag reflex, but we're not going to do that today. Now I'm going to move on to your trachea. I'm going to palpate it and make sure it's midline of the body. Okay, it's midline of the body. Now I'm going to check for a carotid pulse. Do it on both sides, but not at the same time. Okay, now I'm going to auscultate for a carotid bruit. Okay, there's no carotid bruit. If you did have a carotid bruit, that means you have a blockage or stenosis, which is narrowing of the vessels. Now I'm going to palpate your lymph nodes. Just tell me if you have any pain or tenderness. We have your preauricular, your postauricular, your occipital, your submental, your submandibular, your jugular digastric. Can you turn your head? Your deep cervical chain, other way, other deep cervical chain, your superficial cervical chain, and then your post-cervical chain, and then tonsillar, and then shrug your shoulders. And right here is the supraclavicular. All right. Now I'm going to test cranial nerve number 11, your spinal accessory nerve. I have you push against my hands. Push, push. Alright. Now I'm going to do your anterior thorax. I'm going to inspect and palpate your skin. Make sure you don't have a temperature. Your skin color is consistent with the rest of your body. I don't see any accessory muscle use. I'm going to check for a respiratory excursion. Let me take a deep breath. Okay, excursion was symmetric. Now I'm going to percuss your lung sounds. Over the bone, you should hear flatness. And throughout the lungs, you should hear resonance. Cardiac dullness over the heart. Over the liver, you should hear dullness. And over the stomach, you should hear tympany. Now I'm going to auscultate the lung sounds. Listening for any crackles or rhonchi. Okay, lung sounds were clear. Do you do a monthly self-breast exam?
No.
Okay, you need to pick the same day out of each month and do one. You can do it lying down or in the shower. Can you follow my motions? Put your hand behind your head. Start at your armpit or toe of Spence and go in a circular clockwise motion. And then you can go inward and go towards your nipple. And then you pinch your nipple and make sure there's no discharge. If you have any discharge or tenderness, you need to consult your physician and get a more thorough examination. Okay, now I'm going to move on to your anterior thorax of the cardiac. I'm going to inspect and palpate for any visible pulsations. Palpate the precordium, feeling for any thrills or heaves. I'm going to palpate the PMI, or the point of maximal impulse. Okay, now I'm going to auscultate the valves. Right of the sternum, we have the aorta, and the second intercostal space. Left of the sternum and the second intercostal space is the pulmonary artery. Third intercostal space is Erb's point. Fourth intercostal space is tricuspid. And the fifth intercostal space is the mitral. I didn't hear any murmurs. The heart is between the second and the fifth intercostal space. I'm going to auscultate your apical pulse. Okay, I didn't hear any dysrhythmia. Okay, now I'm going to move to the posterior thorax, or the back. Okay, I'm going to inspect your posterior thorax, looking for any kyphosis or scoliosis, which I don't see. I'm going to palpate for tactile primitives. Have you say 99?
99.
Again.
99. 99.
One more time.
99.
Okay, vibrations were even throughout. We're going to percuss the lung fields. Just like the front, I should hear flatness over the bone. Resonance throughout the lungs. Alright, now I'm going to also take the lung fields. Okay, lung sounds were clear. I didn't hear any bronchi or crackles. Now I'm going to check for CVA tenderness or costovertebral angle. Can we feel any pain?
No. No.
Okay. Okay, make sure you check for respiratory excursion. Have you take a deep breath? Okay. It was symmetric. Okay, I'm going to inspect your skin. I'm looking for any edema, erythema, or lesions. Okay, I'm going to check your capillary refill. Okay, they blanched within 3 seconds. I don't see any clubbing. Okay, don't feel like you have a temperature. Your turgor was good. There was no tinting. I'm going to check your radial pulse, your brachial pulse. They were bilaterally symmetric. I'm going to test your strength. Have you push on my hands? Okay, good. Now I'm going to test your neurological sensation. Have you close your eyes? This is dull. This is sharp.
Dull. Sharp. Sharp. Sharp.
Okay, you would do that on both sides. Now I'm going to check your reflexes. This is your brachioradialis, your biceps, and your triceps. Okay, you would do that on both sides. Okay, I'm going to check for capillary refill. Okay, they blanched within 3 seconds, and then I'm going to make sure you don't have any clubbing. Okay, I'm going to have you take a deep breath. Hold it. Okay, good. The contour is smooth, symmetric. Now I'm going to auscultate your vowel sounds. Vowel sounds can be hyperactive, hypoactive, audible, or absent. Vowel sounds were audible in all 4 quadrants. Now I'm going to percuss. Over the apex, you would hear dullness, the liver dullness, stomach tympany, and you would hear tympany throughout the intestines because of air. Okay, now I'm going to palpate. Tell me if you have any pain or tenderness.
No. No.
Okay, good. I'm going to inspect the skin, looking for any edema, erythema, or lesions. You don't feel like you have a temperature. Okay, and now I'm going to do range of motion. We have flexion. While I'm doing this, I'm feeling over popliteal pulse, then extension, abduction, adduction. Don't forget the femoral pulse. Okay, I'm going to check your clonus. Okay, good. I'm going to feel your posterior tibial pulse. And if our shoes were off, we would check for capillary refill of the toes and check her dorsalis pedis. Now I'm going to check your neurological sensation. This is dull. This is sharp.
Sharp. Dull. Dull.
Okay, you would do that on both legs. I'm going to test your strength. Have you push up against my hand? Okay, push down. Okay, good. We're going to check your patellar reflex. Okay, and you would do that on both legs. And then we'll go to our Achilles. Okay. I'm going to check your plantar.